society for the physical therapists in USA. And after that, the physiotherapy saw no back. They were always a progressive one. It was basically a musculoskeletal disorder for the musculoskeletal disorders, but with the beneficial effect of physiotherapeutic interventions, it was included in all fields of healthcare. Now, be it you have heard a lot of interactions since yesterday about musculoskeletal disorders, neurological disorders, pelvic dysfunctions, women health, pediatrics, geriatrics, cardiopulmonary, sports sciences. No field like burns, trauma, plastic surgery, everywhere the importance of physiotherapy is unmatched. Every result of physiotherapeutic intervention is a success. And initially, when there used to be only the referral practice, I'm talking about the change of perspective. There used to be only referral practice when the cases were referred to the physiotherapist in a state where they were not able to be treated by the physicians or any branch of other healthcare profession. The physiotherapists were the last one to treat such kind of patients, but now it's not there. The awareness has come. A lot of things have changed since then. People are coming directly to the physiotherapy clinics, and I think 80% of the physiotherapy practice involves those patients who are directly dropping into the physiotherapy institutions or clinics on their own. So with the advent of, with the increase in awareness, with the increase of education about the healthcare, about the quality of life, people are more concerned, because all these things connect to the economy of a nation. If you are disabled, you are losing more man hours. If you are able, if you are functional, you would be more productive to the society. Not even to the country, but to your society, even to your family. Your values in the families are earned only on the basis of your productivity in the family, your interaction, your communication with the family. So these values have been inculcated by physiotherapy profession. See, physiotherapist is the only one in all healthcare professions you can study. There has not been any study. Some studies I have asked my students, like now they are conducting, that how much time a healthcare professional devotes with his or her patients. You would find physiotherapy professional is the one who would devote most of its time in healthcare practices. The patient physiotherapist interaction is the most. So those things are taking shape now, and we have the accountability for that. This is not the opportunity which we have to miss with, but these opportunities load us with a lot of responsibilities, our accountability. So we must be having those values inculcated from the basis of our professional values, basic of our professional education. And the curriculums are going to be included regarding this also. So once our future generations are coming, those who are coming into the professional field, professional practice, they would at least be in the field with the complete sincerity, with the dedication, and with the bundle of knowledge which have been inculcated into them by their mentors and teachers. So the application of your learning, application of your knowledge into your clinical practice is most important, because you are more accountable now to your patients. Why we are more accountable when it is a referred practice? But legally now, initially there used to be some tussle between the referring physicians, and mostly in the government job. I had been seeing in the government job since 1985, and from there I have chosen a facility or chosen a specialty where there was no referral. In cardiopulmonary, I had the independence of working, but that loads you with the accountability, how to select the patient, how to limit yourself, see the limitations of your work. Once you know the limitations, at least you would not harm the patient. So those are the things which